Generational poverty and environmental issues are deeply intertwined, creating a cycle that perpetuates socioeconomic disparities. Environmental challenges, such as climate change and pollution, disproportionately affect impoverished communities, leading to adverse health outcomes, including compromised sexual and reproductive health. This intersection exacerbates existing inequalities and hinders efforts to break the cycle of poverty. The intersection of environmental issues and generational poverty has been extensively studied. The Ballard Brief by Brigham Young University discusses how intergenerational poverty leads to unsafe living conditions and increased health risks, including exposure to environmental hazards. Additionally, the concept of environmental racism highlights how marginalized communities often face disproportionate exposure to environmental hazards, perpetuating cycles of poverty and health disparities. Marginalized populations often reside in areas that are disproportionately affected by environmental hazards. These hazards include exposure to pollution, lack of access to clean water, poor air quality, and vulnerability to climate change-induced disasters such as floods, droughts, and extreme temperatures. Structural inequalities in housing, urban planning, and infrastructure exacerbate these issues, making it difficult for impoverished communities to access basic resources that support health and well-being. Urban slums, particularly in low-income and developing regions, frequently lack adequate sanitation facilities and reliable access to clean drinking water. Contaminated water sources and unsanitary conditions increase the risk of waterborne diseases such as cholera, dysentery, and typhoid, which can have devastating effects on overall health, especially for pregnant women and young children. Chronic exposure to poor sanitation also contributes to malnutrition and weakened immune systems, making individuals more susceptible to infections, including sexually transmitted infections, STIs, and reproductive tract infections, RTIs. Inadequate sanitation infrastructure forces many women to use unsafe communal toilets, increasing their vulnerability to sexual violence. This heightened exposure to sexual violence contributes to the spread of STIs and unplanned pregnancies, further perpetuating cycles of poverty and poor health. Air pollution, often exacerbated by industrial emissions, vehicle congestion, and the burning of biomass fuels for cooking, is a severe problem in impoverished communities. Studies have shown that exposure to air pollution is linked to reproductive health issues, including lower fertility rates, increased pregnancy complications, and adverse birth outcomes such as preterm births and low birth weight. Additionally, exposure to environmental toxins such as lead, mercury, and endocrine-disrupting chemicals (EDCs) in polluted water and food supplies has been associated with hormonal imbalances, infertility, and birth defects. Children growing up in these conditions are also at risk for chronic respiratory illnesses, cognitive impairments, and developmental delays, further limiting their future opportunities and reinforcing generational poverty. When families must prioritize survival over healthcare, preventive measures like vaccinations, STI screenings, and reproductive health education are often neglected. Women in environmentally marginalized communities face significant barriers to accessing reproductive health services, including contraception, prenatal care, and safe childbirth options. Health clinics in these regions are often underfunded, understaffed, or too far away for many residents to reach. The financial burden of seeking care, coupled with cultural stigmas surrounding reproductive health, often prevents women from obtaining essential services. As climate change intensifies, impoverished communities are among the first to suffer from its effects. Rising sea levels, extreme heat, hurricanes, and droughts contribute to mass displacement, forcing millions into unstable living conditions such as refugee camps or temporary shelters. These environments are often overcrowded and lack basic health services, increasing the spread of infectious diseases and limiting access to contraception. prenatal care, and STI treatment. In many cases, displacement leads to an increase in transactional sex as a survival strategy, particularly among women and girls who lack economic opportunities. This, in turn, raises the risk of HIV infection, sexual violence, and other reproductive health issues. The combination of environmental stress, poverty, and limited reproductive health care creates a vicious cycle that is difficult to break. The environmental hardships faced by impoverished communities directly impact sexual health. Resource scarcity and displacement can lead to increased rates of gender-based violence, including sexual assault and coercion. During climate-related disasters, the breakdown of social structures and protection mechanisms heightens the vulnerability of women and girls to such violence. Additionally, the stress and instability associated with environmental crises can result in risky sexual behaviors, further elevating the risk of STIs and unintended pregnancies. Addressing the nexus of environmental issues, generational poverty, and sexual health requires comprehensive strategies. Improving access to healthcare, strengthening healthcare systems in vulnerable areas ensures that sexual and reproductive health services remain available, even during environmental crises. Education and empowerment. Providing education on sexual health and environmental stewardship empowers communities to make informed decisions, reducing the incidence of unintended pregnancies and STIs. Policy interventions. Implementing policies that address environmental justice can mitigate the disproportionate impact of environmental hazards on impoverished communities, thereby improving overall health outcomes. The intersection of generational poverty, environmental hazards, and sexual health disparities is not just a distant crisis, it is a present reality for millions worldwide. Communities trapped in cycles of poverty are disproportionately affected by climate change, pollution, and lack of access to health care, further limiting their ability to escape economic hardship. Without immediate and sustained intervention, these disparities will continue to widen, leaving marginalized populations more vulnerable to health crises, economic instability, and environmental disasters. It is imperative that we act now. Governments, policymakers, and advocacy groups must work together to implement environmental justice initiatives, expand access to healthcare, and provide educational resources that empower individuals to take control of their reproductive health. Investment in clean water infrastructure, sustainable urban development, and climate resilience programs can help mitigate the environmental factors that contribute to poor health outcomes. As individuals, we can support organizations that advocate for environmental justice and reproductive health rights, push for policies that protect vulnerable communities, and educate ourselves and others about the realities of generational poverty. By acknowledging and addressing these interconnected issues, we can create meaningful change and ensure that future generations are not bound by the injustices of the past. Take action today. Support policies and organizations that prioritize environmental justice, sexual health access, and economic empowerment. Raise awareness, advocate for systemic change, and help build a future where no one is forced to choose between survival and well-being.